PCOS, Polycystic Ovarian Syndrome. I will discuss high yield points for the USMLE. So before starting, I will ask our first question: that who gets PCOS? You have females, especially high BMI females, but it is not necessarily important that they must have high BMIs. But for the USMLE, you should know that patients with PCOS will always have high BMIs. BMI do? Yeah, it causes insulin resistance. But what does insulin resistance have to do in terms of relating to PCOS? Yeah, it causes changes in GnRH pulsations, which results in increased LH luteinizing hormone and decreased FSH, follicle stimulating hormone. Now, what does high LH do? Yeah, it causes hirsutism that we see in patients with polycystic ovarian syndrome (PCOS). But why high LH causes hirsutism uh, in females with PCOS? Well, actually, LH in females acts on the theca interna cells and results in androgen productions. When there will be high LH levels, will result in higher levels of androgens, and that will result in hirsutism that we see in patients with PCOS. And we also see poor follicular development in patients with PCOS. But why? Because FSH levels are low, follicle stimulating hormone levels are low. They result in poor growth of the follicles. So as a result, Graafian follicles do not develop and which do not rupture, and these follicles are retained as cysts. And when this continues over several cycles, it results in, as the name goes, polycystic ovaries, polycystic ovarian syndrome. So, what type of cancer are the females with PCOS are at risk for later in their lives? Here, some students will answer ovarian. Well, it's wrong actually. The correct answer is endometrial cancer. Why? Why the females with PCOS are at high risk for endometrial cancer? Well, here some students will call high estrogen, which is also a wrong answer. The correct answer is unopposed estrogen. What does unopposed estrogen mean? Well, as you know, the patients with PCOS have low FSH levels, which results in poor follicular growth, and as a result, Graafian follicles do not develop and they do not rupture. And what structure actually develops when a Graafian follicle ruptures? Yeah, a follicular remnant called corpus luteum. And what does that corpus luteum secrete? Yeah, it secretes progesterone. Estrogen stimulates the growth of endometrium, while progesterone limits the growth of the endometrium. When there is estrogen without the limiting action of progesterone, that that's what we call unopposed estrogen, and that leads to uncontrolled growth and proliferation of the endometrium, resulting in endometrial hyperplasia first, and then later results in increased risk of endometrial carcinoma. 60-year-old female with BMI 30. Oh, obviously, clearly she is postmenopausal, and now she presents with pervaginal bleeding. And the question stem will ask the definitive test required to diagnose the condition that patient is suffering from. The answer will be endometrial biopsy. Well, you should know that when a patient is postmenopausal, has high BMI, most likely she would be premenopausal. She would have spent her premenopausal years with high BMI as well. and most of her life years in anovulations slash PCOS, that obviously increased her risk for endometrial cancer over the several years of her life.